I want to be treated with kindness and respect, showing some warmth and empathy to the situation that we as parents find ourselves in.
I want to be treated with patience and consideration for how challenging things are, at the same time as being respected for how much we do manage.
I wanted to be treated with kindness and dignity.
I wanted to be treated with respect. Respect for us meant that you understood how many doctors, therapists, treating people that we were seeing, what your role in our child's life was, and how you could best help us get the best outcome for him.
You can treat parents with dignity by listening to what they need. I experienced this when one of his specialists always asked my husband and I how we were travelling before they asked about our son.
You can show respect, care and kindness by really taking the time to listen, confirm your understanding and follow through. I've experienced this when our therapists take the time to get to know us and work alongside us. It's important because this is the most important thing in our lives.
So the one thing for me is to never underestimate the impact a small gesture may have. I experienced this one Easter Sunday when my Eddie had been in hospital for some time. He was incredibly unwell. He was connected to an enormous amount of medical equipment, making it very hard to hold him or be near him. And this nurse took the time to help me bath him and dress him and then let me sit in the chair and hold him. And I will never forget, her name was Emma and I could never forget her face.
You can do that by valuing families' time, understanding their child's needs, making adjustments where required, and doing what you can to confidently and comfortably talk about the reality that they're facing.
It's important because we as parents are grieving every day for the life-limiting condition that our children have, knowing that they're not going to reach the full potential that they could, and that they're going to be taken from us well before their time.
I think it's very hard for people who haven't been in our shoes to understand what hope looks like for a family like ours. But for families like ours, hope might mean something like hope that your child's not going to suffer, hope that if he's in pain, you'll be able to tell us and you'll be able to treat it, hope that his life will matter, that it will have meaning, hope that he'll have happiness, and maybe just hope that he can still smile in a year or 2 years. Simple things like that are probably different to most people. I think when people are faced with old age, they always use the Dylan Thomas quote about not going quietly, right? Raging against the dying of the light. Help us do that, because that's what hope is. Teach us how to rage against the dying of the light.